in a day. That is because the indiscriminate addition of iodine in the salt. Without discrimination, they have added the salt to the iodine to the salt and made it mandatory. Same way with the vaccination now. Without seeing whether you need it or not, whether they don't know your body nature, they don't know whether you need it or not, they don't know about regarding your natural resistance. Irrespective of anything, they started vaccinating. That's why now the cases of cancer, diabetes, paralysis, heart attacks, and all the eczema, all the cases have increased. I am not speaking with any prejudice on any system of medicine, but you being the doctors, you must think before accepting those statements. Thyroid cancer, of course. Now, from here my lecture starts. What is our approach for homeopathic treatment? Our approach is proper history taking. Of course, you all know the proper history taking, but one thing, since I keep teaching the students and keep seeing their mistake by taking the case history, I thought that this is more important. Usually you write known case of hyperthyroidism or known case of hypothyroidism, whatever with the diagnosis they come, you will write known case of so and so. But that will give us no clue for the selection of our medicine. What made them to go to the doctor is more important. That is why we write whether it is hyperthyroidism or hypothyroidism, we say these conditions known due to. Even diabetes, they write known case of diabetes. But diabetes, patient will not go with the diagnosis. One patient may go to the doctor with the delayed wound healing. Another may go to the doctor due to the sudden loss of weight. And one may go due to the excess urination. So these things give us the clue for the selection of their medicine. And not only that, since they have already come with the diagnosis, you can also ask them what symptoms they recognize when their blood sugar is increased. One will say, see doctor, if I get blood in, I know my blood sugar is increased. Many times I have checked it. Another may say, my urination increased, I know my blood sugar is increased. So like this, each patient is unique. Each patient expresses their nature by experiencing their own symptoms. These symptoms are more important for the selection of our medicine. Diagnosis is only good for the sake of management of the case, not for the selection of our medicine. And even proper history taking, as Dr. Shivkumar said, don't take routine. And of course, even we have done it. When I was an internee in our college, Homoeopathic Medical College, Belgaum, they usually keep the printed form ready. So while filling the form, he said, what kind of dreams you get? He stared at us. Then I thought he must be Marathi, he is not understanding Kannada. I asked my colleague to inquire in Marathi. So the moment he asked, he banged him like anything. Then he said, we went back to the case history and saw his main complaint was insomnia. Where he will get the dream? So mechanically we keep doing. Of course, these things happen in the internship. So, but take the experience from your seniors. And my request with the seniors is never deceive the youngsters by sharing your experience. Last time when I had been to Bagalkot, the principal said, "You all must come to the Dr. Madan's level." I said, no one should come to my level. Why should you? With my experience, I have brought to this level. From there you must go above. If you stay there only, where will the system grow? So take our experience, come up, grow further. Don't stay in the same place. So that is one thing. The other one is the importance of family history. I keep seeing the students say, NS. It is easy to write, NS. Not significant. But it is significant for us because family history is the thing which gives us the clue for the miasms. So while asking the family history, don't just ask, he said no. Naturally they say, you must tell them in your direct blood relations. When you say in your relations, they say my wife is that. Wife is a marital relation, not a blood relation. Tell them in your direct blood relations, like father, mother, their brothers and sisters, your brothers and sisters, your grandparents. After telling them the direct blood relations, ask them anybody having diabetes. First, tell one condition, wait for a few minutes. Then asthma, diabetes, piles, paralysis, TB, cancer, ulcer. For anybody hysterectomy is done, or mastectomy is done, or anybody having skin conditions. After telling all these things, then they will start expressing these. One by one you ask them, so you get the details of the family history which will give you the clue for your chronic disease. I keep telling to understand chronic disease, first read chronic miasms of Herbert Roberts. After reading Herbert Roberts, read Allen. After reading Allen, go to the Hahnemann. By that time you will understand what the miasm is and how your family history will give you the clue for the miasms. That is why the understanding of the miasm is more important to prescribe your no-so. Then importance of therapeutics. Even while doing the therapeutics, what you do, you take a condition, write down all the drugs, and you will be in confusion as which one to decide. So after doing the therapeutics, what all the drugs you get? Suppose let us say you have done for the hypothyroidism. In hypothyroidism, he tells about the obesity, sweating, fatigue, hoarseness. And what are the drugs you study, you get, in that, see how is the sweating in that particular drug, how is the hoarseness in that particular drug, what kind of obesity you will get in that particular drug. Note down all those things. Then you can easily understand the drug and the patient and the disease. Many times we have prescribed on the basis of constipation. That is, usually the thyroid problems are recognized with constipation, and in many cases where even the thyroid profile is normal, we have seen having the patient with similar constipation could be corrected with thyroidinum, and plus with the other symptoms the patient is having. Particularly in one case where the patient had the chronic constipation, but the constipation of the type where the stools were hard only in the beginning and the rest was normal. On that basis, after giving quassia, even his thyroid came down. Spongia tosta, of course, of late, the spongia is covering many of the cases, that too particularly after the vaccination. That is because spongia can correct pulmonary tuberculosis. It is the top remedy for pulmonary tuberculosis. And it is the top remedy for pancreatitis. Now after vaccination we are seeing sugar is increased with respiratory problem, and also as Dr. Sudhakar himself expressed that after the vaccination TB cases are increasing. And we have seen even in the lung cancer cases, spongia could get them much relief before it got cured. So spongia in spongia, the constipation is hard, retarded evacuation with itching and smarting in the anus, gets a sudden choking sensation. And also you have seen exophthalmic goiter when it is severe, when there is a toxic goiter, unhealthy skin, palpitation with increased blood sugar and pulmonary tuberculosis. On this basis we are seeing spongia is covering majority of the cases. Next is the iodine. As I have told, the thyroid cases have started after they added iodine with the salt and indiscriminate use of salt with iodine. So I keep telling the patients, once you bring the salt, fry it so that the iodine get evaporated, make use of that salt so the effect on the body will be less. Iodine, the constipation alternate with diarrhea. When constipated, stools are knotty, dark colored and blackish. That is the difference between this and the spongia. Chronic exhausting diarrhea is with iodine, whereas you don't find much diarrhea with the spongia, whereas with iodine you will find more of diarrhea, particularly morning diarrhea, which is very exhausting. More of scrofulous nature, so assimilation is less. Because it is a tubercular drug, your assimilation comes down in tubercular miasm. So we have seen that has helped in improving the assimilation, because the main nature of the iodine is, despite taking good nutritious food, they don't put on weight. Difference between iodine and spongia: iodine better from cold air, spongia worse from dry cold air. Because now the iodine and spongia is more getting indicated in majority of the thyroid cases. Iodine chronic exhausting diarrhea, whereas spongia has hard stools with retarded evacuation. Iodine has constricted feeling, aphonia and hoarseness, whereas spongia more of puffed face, exophthalmos, choking present in both, but more in iodine than in spongia. Spongia has the great hunger and obesity, whereas iodine has hunger and emaciation. Iodine more with digestive disturbance with thyroid, whereas spongia more with respiratory disturbance and pancreatic disturbance with thyroid. Iodine more with body heat, disturbance of bone metabolism, spongia more with muscular weakness and sugar and insulin disturbances. That's why because of the insulin disturbances, we are seeing variation in the menses also. Because where there is a delayed menses, invariably their serum insulin is more, where the gynecologists give the metformin, but we have seen after giving insulin 30, their menses got regularized. Both has the menstrual disturbance, which is increasing of late after side effects of COVID vaccination. Prescription from other approaches. So usually when you do the repertory, either you get Kali iode, calcare iode, or spongia, or the iodine. Now, in some cases, when we have observed a different symptom, we could prescribe these medicines by correcting to correct their condition. Graves' disease, where in many times where the thyroid is observed after the exophthalmos. We have seen after the only on the basis of this exophthalmos, we have prescribed amyl nitrate, and we have seen their eyes have come to the normal size. See, this is of course magnetic poli ambo, or north is Arcticus and south is Australis, but we usually use the magnetic poli ambo in many cases of thyroid infertility, because in infertility we are seeing AMH is not being produced by the pituitary, because in many cases we observe the cell phone towers were staying around them within 500 meters. Then we saw actually in the first case, a girl herself told that she has the cell phone tower just on the top of her room. Can that be the cause of the excess discharge? We thought why it may be, because they were telling the electromagnetic rays of the cell phone towers is affecting the pituitary. Thereby the whole hormone system get disturbed. Why can't we try this? After giving magnetic poli, we are seeing discharges are coming down, AMH is improving, thereby the follicular study is improving, and conception is taking place. So we can make use of the magnetic poli ambo because of the present day advances. And that also is helping in new moon and full moon day affections. Many times patients have expressed, sir, definitely I know my condition increases with full moon and new moon days. Because on full moon and new moon days, even the tide vary in the sea. That is due to the earth magnetism. We thought why we should not try magnetic poli here also. We have seen after prescribing the magnetic poli, now he says, I am not identifying whether it is new moon or full moon, and because of my lack of disturbance. The other one, usually you must have seen the patients with thyroid snore more. Particularly their thyroid is noticed due to the snoring and sleep apnea. They get the choking. So we thought, if you read Grindelia robusta in Clark, he says the patient gets up with the fear that his breathing is stopped. So that choking tendency could be corrected with Grindelia robusta. Recently it was given to one of my patients. So in his next visit he expressed, sir, my snoring has stopped, but the side effect started. So how come this start the side effect? No sir, snoring stopped to me, but for my wife it started. So side effect. So with this, you can prevent people going to the sleep apnea. Sleep apnea, after prescribing this we have seen, where the patient was advised for the sleep apnea machine could be corrected with Grindelia robusta. Echinacea. We have prescribed this echinacea on the basis where the thyroid patient who are very lethargic and wants to keep lying always. See, if you read echinacea and pyrogenum, both has the toxicity in the body. Whereas the echinacea wants to keep lying, whereas pyrogenum, he wants to move about. But because of the weakness, he cannot move about. But there is a desire to move about in pyrogenum, but there is a constant desire to keep lying in the echinacea. Helix toaster, you must have seen the thyroid patients are very sluggish, keep running very slowly. any work they keep doing slowly, where the thyroid noticed due to this sluggish movement, we have seen after prescribing helix tosta, their thyroid TSH profile also has come, thyroid profile has become normal. Gallium arsenide, we are using this in cases of thyroid tumor, breast tumor, tongue tumor, because if you read Clark, he says it can prevent tumor going towards the cancer. So in the beginning, if you prescribing gallium arsenide along with the breast tumor medicine, this works like a catalyst to enhance the work of the indicated medicine, and we have seen it got the tumor got prevented progressing and has resolved. You must have seen these flowers, Trifolium pratensis. In many cases of tumor where it is tending towards ulceration, open up. In breast cases, particularly tumor, they open up and become ulcerating. So this prevents ulceration, tumor going towards the ulceration. This information you will get in Murphy. This is Bayangnan. Bayangnan belongs to the natural order Loganiaceae. This we have seen where there is sudden excess bleeding from the cancer tumors, whether breast tumor or thyroid tumor, any tumor, if it starts bleeding, if you give Loganiaceae, we have seen the bleeding and smell of the tumor comes down. If you don't get this, you can give nuts also, because nuts, ignatia, and this all belongs to the natural order Loganiaceae. This is ignatia. In cases where there was a suppuration in the thyroid, glands getting suppurated, because in one case of a child where there was a lymph gland got suppurated, and where they wanted to operate, with ignatia we could correct it because the suppurated gland looks like a bubo, prescribed on the basis of appearance. And since it is in the neck and the suppuration of the gland could be corrected with ignatia. Carbonimanis, we know where there is a thyroid gland is less, but around the gland there will be more of lymph glands, particularly in the neck, get corrected with carbonimanis. The indication is more of lymph gland around the neck. We have seen even many times when there is more dandruff and scratching, you will get the enlargement of the lymph glands, which could be corrected with carbonimanis. We have prescribed thyroid, pituitary and carcinosin. Thyroid where there is a T3, T4 is more. When the TSH is more, we have prescribed pituitary. And when there is a family history of cancer, and with the thyroid problem, if there is a disproportionate extreme weakness, could be corrected with carcinosin. And oleum jacoris, in cases where there is a hirsutism and also dwarfism in children, after prescribing oleum jacoris, we have seen the heights have increased in the children. Cobalt. Of late, we have observed this. Usually the allopathic doctor says, your vitamin B12 is less because you don't take non-veg. If that is the thing, since how many years the vegetarians are surviving? And even in non-veg people, we have seen the vitamin B12 is less. And if you check vitamin B12, in cancer cases it goes more than 1500 and 2000. And invariably where there is a family history of cancer, you can observe the patients, non-vegetarian patients, their complaint aggravate from non-vegetarian. So they say non-vegetarian supplies vitamin B12. Vitamin B12 is cyanocobalamin, which contains cobalt. That means cobalt is aggravating their condition. On that basis, after prescribing cobalt where there is an aggravation from the non-vegetarian, we are seeing not only their condition is improving and their disagree with the non-veg also has improved. So thanks one and all for patience. So all these things are from my experience, and when I failed with my repertory, I developed these things also. Of course, many times students get the confusion when they attend a conference, because one speaker says I have prescribed on the basis of mentality, another one on repertorization, another one on PQRS symptoms, another one may say on doctrine of signature. But all these things are necessary, and plus your observations, as Dr. Shikumar said, these things, any method you can use depending upon the clue that you are getting in the case before. Thank you very much.
Thank you very much, sir. There are no words as due to time constraint, Dr. Vijeshna sir has left. So on his behalf, I am taking over. Once again, I thank Dr. Madan sir for his time, because once we call him, always he is there for us. So that is the connection between Madan sir and homeopathy. Right? So his knowledge regarding homeopathy, the family, the contents, the active principles about different minerals, and his correlation to homeopathy is something great, which a learner cannot learn in his lifetime. So I request sir to keep on teaching us always, and thank once again, and I thank all the audience for their patience. I call upon Dr. Rajesh A, the working president, to deliver the word of thanks.
Sorry for the delay. I would like to thank our principal, Dr. Guru Prasad sir. So I would like to thank our principal, Dr. Guru Prasad sir, the entire staff of Government Medical College.